Righty, let's get started. Dr. Burt here, upper cervical specialist. And so I just got done speaking at the AIR Institute's annual symposium. And AIR stands for Airway Invisalign and Rejuvenation Institute. Just a wonderful organization of dentists and orthodontists that are really specializing in helping people with sleep apnea. And so Dr. Jeff Skinner is the founder of this organization. And, he believes in natural methods to correct the bite and the airway and really getting people off the CPAP and really fixing sleep apnea for good, going after the root causes. And personally, I've been sending Dr. Jeff patients just who are suffering with sleep apnea, snoring related problems, and they all get really, really good results. And sometimes as quick as just one visit. And it's really nice because his office is so close to mine. It's a blessing to have him because people are traveling all over the country just to see him. And lo and behold, he's in Hillsborough, which is just 10 minutes away from my clinic. And, with that said, they just had their annual symposium. There were well over 100 dentists there and orthodontists. And so Dr. Skinner asked me to speak about how the neck relates to the bite and the airway, which does, of course, influence the sleep quality. And so why would he ask me to do such a thing and speak? Well, because he's found that when a patient has a crooked neck, then that does indeed hinder their ability to heal, and it also affects their bite and airway. And so this has to do with the muscles of the neck, jaw, and throat. They're going to be in spasm when the neck is crooked. And so he finds that he gets better results when I can align their neck first, which helps to relax the muscles, which then helps Dr. Jeff balance out their bite, open up their airway, and he's got great ways to test this. And so he also, how he knows if the patient's neck is crooked is, well, I'll just say this, the best part of working with just dentists in general is that most of you are taking, most of dentists as in you, assuming dentists are listening to this, but most of you are taking cone beam CT scans of your patient's teeth. And so the good news with that is the upper neck, the atlas and axis sit right behind the upper teeth. And so Dr. Skinner takes that cone beam of the upper neck and can see the teeth. And it only takes him an extra minute or two to really analyze the atlas and axis. And so he finds that if they're twisted or tilted, then it's an easy referral. And so it's really simple. And so that was my presentation. That's what we did. That's what I talked about. And it was very well received. It was about a 45-minute presentation. And so I figured, hey, I spent days making the content, a lot of time making the presentation. And so why not record it here on Zoom and post it up for more dentists, orthodontists, and even chiropractors to see. And so that's what we're going to do here. Let's jump right in. First slide. So we got really an interesting, let's see, come on there. There we go. So I always get the question, why would someone need an upper cervical specialist? And I'll tell you, it's because of choices like these. I exist, upper cervical specialists exist because of neck trauma. People hire us because they've either recently had an injury or they had an injury a long time ago, and then 20 years later, now they're starting to notice more symptoms. And so, these symptoms, they can be neck pain, headaches, it can be migraines, it can be vertigo, other symptoms can show up. It doesn't have to be these, it can be others. And because it really depends on how you get injured and what exactly happened to the nerves, how the nerves are compromised, because there's a ton of nerves in the upper neck. So most of you may not know this, but 4 years ago, I was pretty popular on TikTok. I, react to these crazy videos of people doing stuff like this, injuries, whatever it might be. And so, I actually got up to 150,000 followers. And then I stopped posting the short form. I wanted to focus more on the long form. content like YouTube and, teaching, more professionals, dentists, massage therapists, physical therapy, personal trainers, right? So I'm really focusing more on long form content to help the professionals. Even though professionals still go on TikTok, but I don't know, I really like doing the YouTube stuff better. But anyways, I would really teach how the neck impacts the above, down, inside out concept. And so whether we look at an injury like this, I mean, even though the target area is the neck, you're also going to see changes above the neck, right? So the brain's going to be affected, and also below the neck, the body. And so you got to get these global reactions that happen from neck injuries. And of course, obviously, we'll stay, that's a different talk and a different presentation. But today we're focusing on the bite and airway. And the sad part is most of these people, they forget. They forget they were injured. And even just this week, I had a patient just, they came in and they're like, I've never injured my neck. And then by their next appointment, they're like, oh, by the way, I didn't mention this on my form, but when I was in college, I shattered their collarbone mountain biking. And so it's just tough because most people aren't going to remember their neck injuries. They brush them off, pain gets better in a few days, but it really doesn't. The problem doesn't get better. The pain might get better, but the problem doesn't get better. And so because of these underlying injuries are still there, the pain does continue to come back periodically in the future. You get flare-ups and until you actually get it corrected. And so that's what we're looking for, getting these things corrected at the root level. And that's why this content is really important to learn, for everyone to learn. Obviously, chiropractors looking at this stuff, but we need dentists looking at, we need orthodontists looking at the necks. And so we need more doctors on board because nobody else is looking for these injuries. Sure, the medical doctor, might see some of these, but really they're focused on severe neck injuries, like severe where things are broken, and people are getting paralyzed, right? So breaks and stuff. But we really want to pick up on the subtle misalignment injuries, that don't quite need surgery. So it's really important not to neglect these. We need to not neglect diagnosing them. And so we have to be taking cone beam scans, x-rays, some form of objective scan to be able to evaluate these injuries and these misalignments that people are getting. And we have to be looking at the neck. So question that I asked all the dentists at this conference was, how many of you take cone beam? And so what happened is 75%, give or take, raised their hands. And then I asked how many actually are looking at the upper neck, the atlas, and the axis, in addition to the teeth or the TMJ. And about 25% raised their hands. So that's good, but it could be better. And so that's my goal, obviously, with my talk and even this, is we need more people looking at necks. That's actually my goal for the next conference too, is I'll probably go back and speak again, and hopefully we can get that number up to 100%. That's the goal. And in addition, I want to be able to give them some action steps that really they could take and implement as early as Monday morning when they head back to work. And so that's what we wanted to focus on at the conference: communication, help them feel more confident, analyzing cone beam and looking at the neck. Obviously, they're good at analyzing cone beam for the jaw and the teeth and the airway, but we want to at least shine the light on the neck. And so as I said earlier, not only does the neck influence the bite and the airway, but it can also influence other parts of the body and cause other symptoms. And so again, depends on what nerves are compromised, how the injury happened. Did they get hit from the left, from the right? Was the head turned to the right? Did the neck snap backwards? Did they hit their head? And so there's so many variables and combinations that can happen. So just take the picture and look at it. Now, so in all seriousness, quick anatomy review. Let's go through this really quick. So the top bone in the neck, we have the atlas vertebra, C1, and it holds up the head. And of course, the upper teeth are connected to the head. And then, of course, the lower teeth are connected to the head by the jawbone or the mandible. And so, quick exercise I want everyone to do here is if you are watching this right now, go ahead and move your lower teeth. How do you do that? All right. Moving your lower teeth. You're moving your jaw. Easy to do. Now try and do that with your upper teeth. How do you do that? Can't really do that unless you tilt your head. And so that just goes to show you the upper teeth are connected to the head. So if the head gets injured, what's going to happen to the teeth? The teeth are going to be crooked as well. Head's crooked, teeth are crooked. And people are like, well, okay, if the head's crooked, upper teeth are crooked. Well, doesn't the mandible or the jaw match that crooked head and crooked upper teeth? And so you'll still get an even bite, right? Because, crooked matching crooked, right? It's all synonymous there. But the challenge is the muscles. And so because the muscles are tightening on one side more than the other, that's what leads to the bite problems, is because you have muscles. And Dr. Schulten, one of my mentors, he talked about this. But he basically said, okay, what happens if you drop the left shoulder and then really tilt your head to the right and then bite? Where do you feel it? You're going to feel it more contact on that right side. And then vice versa, do it on the left side, right? So tilt your head to the left, drop that right shoulder, and bite. And so the whole point of that is the bite can change given muscle tension, stretching, right? It does have an impact. So that's really important to note. And as far as what I just said, yeah, the atlas is crooked, the head's crooked, the bite's crooked. And how do we know this to be true? And we can talk about the 2022 Rockabato study. And if you want, you can read all this. You can look it up. It's on PubMed. But it's basically saying that the relationship of the head and neck will influence the bite. And this is based on how the upper teeth occlude or touch with the lower teeth. This section here basically saying that the head and the jaw is controlled by 40 muscles, 20 pairs, 20 each side, and that if the head is tilted, then that means these muscles are going to stretch, which affects chewing, a lot of other things. And so read that. You can pause this too and read these if you want. This one's actually really interesting because this referenced a study that was done on rats, and they found that if the researchers messed up the right molar of the rat and they had them occlude, right? So bite down, this threw off the bite. And what else did they notice? Well, they noticed that every single rat developed spinal scoliosis. Not good. So then afterwards, they created a composite on the opposite side, the left molar, to balance out the bite. And what did they notice? They noticed that the scoliosis improved. And so it's really interesting. These, periodontists, they're actually helping a lot of people with even scoliosis beyond just the teeth, and you probably don't even know it. So in summary, we have neck alignment influences the head position, and then it's also going to impact the upper teeth and lower teeth and can lead to a lot more problems. I think I'm on airway. Let's move on to airway here. So the airway can be affected by both the entire neck, the entire cervical region there, as well as C1 at the top. And when we think about this, what might cause someone to lose their proper cervical curve? Well, the most common way is to get rear-ended, some sort of whiplash injury, where you're going to see the upper neck hyperflex and that lower neck's going to hyper extend. So hyperextension of the lower, hyperflexion of the top. And why is that a problem? Because it's not good for the airway. And that's what we're focusing on. Obviously, there's other problems that come with that, but it's really going to impact the airway. And it's going to become a problem for the airway because it is going to exert too much pressure on that posterior wall of the pharynx. Go back to anatomy here. We look at the pharynx. We've got it separated out in three regions. That oropharynx is literally right there, C1, 2, 3, sitting right behind that region, that oropharynx. And so as the neck at the top hyperflexes or straightens, you're going to see that airway compression. And when the airway is compressed, you can't breathe properly through the nose. You can't oxygenate your brain properly, and you're not sleeping well because you're waking up. Some of these tests Dr. Skinner shows me, people are waking up hundreds of times in the night, interruptions, so not quality REM sleep. And, we have the science to prove this. We have the 2020 clavel study, and we basically, this is saying that as flexion increases, you're going to see that upper airway collapse, and vice versa when extension increases, right? So again, looking up, extension, flexion. When you're looking up, it's going to increase the stability of the airway and going to open that up. So that's really important to look at because there's so many obstructive respiratory conditions and events that can happen during sleep. So when we look at this, that's the curve. Cervical curve. So now we want to move to the atlas vertebra, C1, top of the neck here. So the atlas can misalign several different ways. Can either side slip, I guess it's two ways, right? Or it can have combination of both side slip and twist, rotation, and side slip is also aka is tilt. And so the problem with these atlas misalignments is that it's going to compromise a lot of different nerves, but specifically we're going to have cranial nerves affected. 9, 10, 11, 12, really, really important there. But here's the thing, like the brain is going to tell the muscles to tighten when these nerves are compromised. And the body and brain does that because it needs to protect what's most important, the nerves, the brainstem. So that's the thing. You're going to see the muscles of the neck, throat, and jaw go into spasm. They're going to tighten on one side more than the other. It's all going to depend on how C1 is misaligned, how's it shifted, tilted up on the right, tilted down on the right, twisted forward on the right, tilted or twisted back on the right. So there's, again, a lot of combos that these injuries can cause the atlas to do. Cause it to injure. So this photo here, love this one. It really emphasizes the proximity of cranial nerve 9, 10, 11, 12. So I don't really have my mouse here to show. But look at the atlas. The atlas is right there, axis right below it, C1, C2. There's the nerves. So you can imagine if C1 were to tilt or if it were to twist, wouldn't be good for these nerves. So that's again why the muscles are going to tighten on one side more than the other, because they're going down both sides. This is just one side that it's showing. So let's talk about cranial nerve 9, glossopharyngeal. It's not good for this nerve because this is controlling. We've got the soft palate, the muscles to the pharynx, the larynx, stylopharyngeus, superior pharyngeal constrictor, all the key muscles that tell the throat what to do and control the throat and its function. So vagus nerve number 10, also really important for the airway because it also controls the muscles to the throat. Vagus nerve, it's an interesting one. It's the longest nerve in your body, and it innervates the most amount of organs. And really, it's like it innervates every organ except one. The adrenal gland is the only one that's not innervated by the vagus nerve. So I did. The amount of research coming out about the vagus nerve is quite substantial. That's why if most people hear all the cranial nerves, they're going to remember the vagus because it gets talked about a lot more. Okay, cranial nerve 11, accessory. This one's controlling a lot of muscles, trap muscles, trapezius, upper shoulder there. Sternocleidomastoid, kind of that one right that wraps around clavicle mastoid process, ear bone. So it's going to control a lot of the head rotation. Again, a lot of times when people have injuries, they can't turn their head. Saw a guy at the gym the other day. I was walking out and I could totally tell, and he can't even turn his head. I'm like, dude, you got to get your neck fixed. It's the atlas bone twisted, because if it's twisted, SCM is going to lock down and be a problem for people. So again, people can't turn their head, or they flared up sleeping or whatever. That's likely because the atlas bone's pissed off, it's misaligned, it's injured, and then the muscles trying to hyper guard, pull it back to center. Again, it won't let you turn your head because your body feel that is a threat. Okay, moving on. Number 12, hypoglossal, controlling the tongue, controls the suprahyoid, infrahyoid, geniohyoid, has a lot to do with swallowing, speech, and eating. And lastly, we have spinal nerves, 1, 2, 3, C1, 2, 3. You can basically see that the brain controls a large majority of the body. But these cranial nerves and these spinal nerves, these 7, 4 cranial, 3 spinal, really have such an impact on really everything that goes on in the head neck region. So there's another one. I put that in twice. Okay, so here we go. Dr. Skinner sent me this patient a couple months ago. So we got a nice, really good outcome with Bobby here, 45 years old. So here's the thing. He sent him to me originally because it's funny. You have a crooked neck, go see Dr. Burt. And he's thinking, I'm here for my teeth, man. Like, why do I need to go see this neck guy? Really nice guy, but it was funny trying to communicate basically this to him in a simple way. And so Dr. Skinner sent me his cone beam scans. And you can see, twisted atlas, upper left corner here, flattening of the cervical curve, upper right. His bite was off. The airway was compressed. So upper right, upper left there. You can more see it in the upper right. He's got nice software to evaluate that. But then look at the C2 also, right below that red dot upper left. Look at those foramen. Gosh, I really wish I could point to it on my pointer here. But nonetheless, it's twisted and way further off than Bobby knew. And Jeff was like, yeah, dude, you got to get this fixed. So anyways, that's the view Dr. Skinner sent me. And then there are the 2 lines that I drew. You can kind of see those 2 red lines on C2 and C3. And so what I see here is C2, C3 leaning forward, right? They're the parallel going forward towards the airway. And what's happening? Posterior wall oropharynx getting compressed. Not good for the airway, not good for breathing, not good for his sleep. And so when he came in to see me, I took his x-rays to compare his cone beam scan to, and this is what I found. So the left side is the normal x-ray and in normal neck curve, right? You want that reverse C. So looking at the side, it should be going backwards C. Look at the green line there. And then Bobby is over to the right. You can see it's straightening there. Now, remember what that Roccabato paper said. The top posterior corner of C2 should be behind the bottom posterior corner of C2. So C2 should be angling up and back. You see that on the left, how that top arrow is behind the bottom arrow. And then you've got Bobby on the right side. See how that top arrow on the right is in front of that bottom arrow. That's not good. That tells us that airway is getting compressed. Yeah, I was going to bring this up too. Look at his, on the Bobby side, look at his right here on his skull there. That's the external occipital protuberance there. Look how thick that is. It's like a hook. And so that's how I can tell if someone's had whiplash long ago, because over time, that NUCCA ligament, it's gonna tighten, tighten, tighten. And so when it snaps forward like that, boom, you start to build up tension up there. And also, over the years, this can happen just as the muscles tighten and stay tense for years, it's going to be tugging on that. And so what's the body going to do? Going to deposit calcium there, because calcium is stress response. We've got Wolff's Law there. Does that for a reason, to keep it protected, stable, and strong. Okay, what did we see on Bobby's intake form? Neck injuries. When he was 12, he crashed his bike. He landed on his head. He blacked out for a moment. And you think, does that have anything to do with this? Car accident, that's the most common thing people have. At least, I forgot the stat on that, but I remember when Dr. Murphy was teaching us, he would say that people are in a car accident every 10 years. That's the stats. Every 10 years. I know that's terrible to say. So be careful when you're out there, people. Okay, so here's a different view that I took, which evaluated his head tilt and also his atlas tilt. Now, his head tilt was the largest component of his misalignment, measuring 4.5 degrees tilted to the left. And so it's important when taking this x-ray that he is seated with his eyes closed. Now, I do that seated with the eyes closed so that it inactivates the righting reflex. Now, the righting reflex corrects your tilted eyes when your eyes are open. And so think of it like this. If your head tilts from an injury, your eyes are also tilted, right? Obviously. And so to compensate for this, your righting reflex activates, which is going to cause your shoulders to tilt to bring you back to center or to level out your eyes. So I'll do that again. Again, boom, you get injured, head tilts to the left. What happens to the shoulders? Again, you're not going to walk around like this with your head tilted to the left. So what you're going to do, you're not going to tilt your head either. The body doesn't do that because it could be injured. So what you'll do is you'll actually, let me get a little bit closer, head tilts to the left, boom, right shoulder comes down, and that head tilt becomes more level because the eyes are now seeing level with the earth we live on. But now you're going to see compensations to the shoulders and the spine. So that's, again, a compensation mechanism that the body has. Anyways, so the whole point of that is when you close your eyes, your natural head tilt will come back if you have any. And so with Bobby's, had to take his x-rays with his eyes closed. Because if you opened them, boom, that head tilt, it's not as accurate. All right. Moving on to his rotation or the twist component of his misalignment. And so what we have here is basically C1 twisting back on the left 2.2 degrees, and then C2 twisting forward on the left 6.9 degrees. And that's not good because this is considered a counter rotation. And that's not good because it adds a lot more tension in the neck and the nerves, those cranial nerves. Because if you take another look here, just imagine, Atlas, right? If it's twisting backward and then axis. So if Atlas is twisted backward, axis below twisted forward on that side. Now we're starting to affect both cranial nerves 9 and 10. Again, on both sides, because what's backward on the left is forward on the right, and then vice versa for C2 below. So you can see, again, both nerves are impacted on both sides, right and left. Okay, so when I finish measuring his neck scans and comparing them to the cone beam, this is not Bobby, by the way. This is someone else. I should have got a video of Bobby. But basically, I have all the information that I need to properly realign it. And so we can correct for, I can correct for 4 different misalignments, that are created by the injury. One's the head tilt, atlas twist, and then the axis C2 twist. So I know it kind of seems a bit complicated. It is, but it isn't. But the summary is, it's so important to take these scans because that's going to show me how to do the adjustment, where to stand, how to position his head. And then the most important component is evaluating how the adjustment did. How were my angles? Were they accurate? And so I have to take another post scan immediately after, not 6 months after, immediately after, to evaluate his alignment, make sure it's improving, make sure I actually did my job. And so that's what I did. You can see here after the first realignment, his head tilt did get better. It wasn't complete, at 4.5 down to 2.8. So I did readjust a few of my angles to get that extra bit of improvement. And once I was able to do that, we did get it down to, gosh, 0.5. And you can just see really, really good outcome. And that's the thing. Sometimes you got to be persistent with it, and it doesn't always just correct after just one. So stay with it and take the time, because again, sometimes I get it, chiros, we get busy, but get it right the first time and make sure the job's complete. And then after we did this, Dr. Skinner took a cone beam. He was able to do his work more efficiently. And then I think, yeah, he did his work, and then he took another cone beam to evaluate that airway, and just look at the airway improvements, and just, his brain's getting a lot more oxygen. Breathing is going to be easier in his nose. I know he said that too. Bobby told us that. Yeah, a great outcome for Bobby. He was really thankful to be sleeping better, to not have to get a CPAP, which is, I think, what his medical doctor, someone told him to get a CPAP, and so he didn't want to do that. And that's how we found Dr. Skinner. But yeah, we're able to help him naturally. And for me, I use my bare hands, no needles, no pills, no lotions or potions, none of that. Dr. Skinner, he used PEMF. He used like 3 different kinds of laser, different power, different frequency, wavelength, all that stuff. Kind of get complicated there. And then he finished with what's called a T-scan. And that's basically kind of making some of the final touches on the enamel, the teeth, to make them bite proper. Just the occlusion. It's like a fine-tune occlusion piece of equipment. Anyways, but just a holistic approach where, it's, I'll tell you this, I get so fired up about collaboration, because that's what it takes. You've got to have the right team, the right doctors that truly care about your results. And we want that for our patients. Again, if you're a dentist watching this, but that's what it takes. Sometimes it does take both the neck and the jaw, airway, TMJ, all that, to be able to get a good outcome. And so make sure you're collaborating on the treatment plan. And that's really how I think you're going to get the best results for your patients. Because again, this is about whole health, right? Even for me, neck, hey, that's great. But also, yeah, we want to address the teeth if they need to be helped, and so that's the thing. Okay. Here's the thing. I gave a lot of the dentists after this, just some action steps that you can immediately start implementing. So start looking at your intake form here. But just start asking your patients if they've ever had any neck injuries, because the majority of your patients have. They probably have played sports growing up. They may have been in motor vehicle injury, accidents, collisions. And I'd say, yeah, those are the 2 most common injuries that people are going to come in with. But then you can ask them if they're suffering from any of the following symptoms, just because there's a good chance that crooked neck can be contributing to that. So we got chiropractors. If you are watching this, well, you need to be asking your patients if they snore and if they've ever been diagnosed with sleep apnea, and CPAP. So I think, yeah, that's it. So chiropractors, put on your intake form, snoring, ever been diagnosed with sleep apnea, or if they have a CPAP currently. And that's going to be your best way to start building relationships with dentists, airway dentists. And then you also need to be looking at your neck x-rays and be looking for that curve. Because if you're seeing the lateral curve straightening, compressing that posterior wall of the pharynx, yeah, you got to refer out for that because your patients need that information. And yeah, I mean, we both chiros and dentists need to be looking at for mouth breathers. And again, as tough as this one is to say, look at their face. It will be shaped differently. That's just what happens. Because the problem is that most mouth breathers, they're like that because their neck is crooked and their airway is compressed. So they really need our help, and amongst other things. But these, they're not breathing right, they're not sleeping right, they're not oxygenating their brain, and they're more likely to have memory problems in the future because they're not sleeping right and they're not breathing right. So really important to look at that. And then dentists, finish on this. Look at in addition to looking at the teeth and the airway, look at the neck. Spend the 2 minutes, atlas twist tilt, and then if you can get that cervical curve just a little bit. Obviously, you can't see all of it, but you can see C1, 2, 3, sometimes C4 if the shoulders allow your cone beam scan to come down. So zoom in on the atlas tilt, right? So that's from the front there. You can, just eyeball that. You have some annotations on your software, or at least you should. You can zoom in on the axis, C2. So you just scroll down a little bit further on that view. So you want to make sure that the crosshair is on C2 on all your quadrants. I know the software that Dr. Skinner uses that he invites me to is Invivo, INVIVO. Love that software. He can analyze, I can analyze, and then of course I have my own software too. So it's wonderful. Hopefully you have something like that. And then yeah, look for that cervical curve, looking for that straightening. And yeah, collaborate. I can't emphasize it enough. Especially airway specialists, if you're a general dentist, get some specialization with the airway, because get to Dr. Skinner's events, he's really knowledgeable with all of that stuff. We got to help each other so we can help our patients the best. And I mean, even if you sent me an email, with something, like this here, I'd be thrilled to respond to this email and take a look at the cone beam and, collaborate that way and, in a heartbeat. And so, and then return, I would obviously ask you kind of what you're looking for, with your patients, with the teeth and the jaw. How can I use that for my cone beams or my x-rays, whatever the chiropractor is taking. So that way we're looking for the same things. You can do lunch and learns and teach each other. Hey, you can send them this master class here, send them the Rockabato, the Clavel studies. All that PubMed is great research for learning. That's what I wish I would have learned in school, aside from adjusting, but just read more PubMed and what the research shows for the neck, jaw, the airway. Okay. And then this is basically my information. At the end of the day, I want what's best for our patients and, happy to help. So my clinic's here in Beaverton. I understand most of you probably aren't even local to Oregon. But hey, if you're, got a tough case and, you want to shoot me an email, send the cone beam to this email, drburt@eliteuc.com. Happy to take a look. Happy to, help you out in a way that I can, because I'm passionate about this stuff. Like I really do like working with dentists and orthodontists. You guys are great. Your conferences are great too. You're not local, so there's a few organizations. If you don't want to send me an email, that's fine. But you can go to NUCCA.org, look for a doctor. If you can't find one local to you, you can look at uccnearme.com. And then you can also email me. I can see if I can get you a doctor. You can even Google Upper Cervical Chiropractor near me, and something might show up. Just whatever you do, don't send your patients to a chiropractor who will do this. Talking about permanent ligament damage. The brainstem is not meant to withstand those jerking y-axis adjustments. Just terrible. But hey, they get a lot of views on social media and people get popular from them. But yeah, definitely don't do that. You're asking for problems. Gosh, yeah, less is more. and lighter is righter. That's our motto. But anyways, that's it. I hope you learned something new here. That's all I got. Hope you have a great day. And again, reach out if you need any support or have questions. Happy to help. Take care.